So we provide insurance for 400,000 people, and essentially no cost to the state over the first 10 years. Congress really wanted states to take advantage of this opportunity, so they included some pretty generous financing. It would be 100% financing for the first 3 years, 100%. No state money at all. Can't say that enough times, 100%. I mean, this is a pretty good deal. And then the state slowly chips in after that, never has to pay more than 10%. Today under Medicaid, the state pays for about 40% of the care. The federal government pays for the other 60%. So it's a much better cost match here. And we've been looking at some of the numbers and think that in the first 3 years especially, we could save tens or hundreds of millions of dollars those first 3 years when it's 100% federal financing, which is so important given the very awful budget outlook in Baton Rouge. We have $1 billion shortfall, billion with a B, going into the next year, and that's going to mean more cuts to education, more cuts to healthcare, more cuts to basically everything. I mean, you can only cut for so long before you're going to get to just about everything. So, unfortunately, as I know you know, Supreme Court upheld Obamacare. That part was good, but they made Medicaid expansion optional for states. Before that, it was mandatory, and Governor Jindal was very quick out of the gate to say that Louisiana would not participate in Medicaid expansion, that we would somehow figure out another way to take care of the 800,000 people who are uninsured in the state, the 1 in 4 adults, and we're going to turn away the federal financing, literally billions in financing over 10 years. And we think that's a mistake for a couple of reasons. One, the financing is just too good. I mean, it would save the state money. Right now, the idea that we don't pay for our large uninsured population is a fallacy. We pay hundreds of millions of dollars a year to LSU hospitals, to other providers, to help provide care to the uninsured. And also, folks with private insurance pay higher premiums due to cost shifting to the uninsured. So there's already a large cost that we bear for the uninsured. And transitioning folks from being uninsured into the Medicaid program, would help relieve some of that stress on costs for a couple of reasons. A lot of folks who are critics of Medicaid say it's bad care, and I'm not going to say it's perfect. We definitely need to do a lot to reform Medicaid. We need to do a lot to reform the healthcare system in general, but we have empirical evidence that Medicaid coverage compared to being uninsured brings significant benefits. Folks on Medicaid more likely to have access to a primary care doctor, more likely to be able to take prescription medications they need, less financial stress on families, even reduces mortality rates. States that voluntarily expanded Medicaid to adults saw fewer deaths. So literally life and death issue that we're talking about, and that gets lost, I think, a lot when we're talking about numbers, and I include myself in that because I spend a lot of time talking about numbers, but literally life or death issue. And the other thing we have to consider when we look at costs is the cost of doing nothing. If we don't expand Medicaid, we're going to continue to have hundreds of thousands of uninsured people, and as I know you also know, the LSU system, the traditional access point of care for these people, is undergoing radical transformation, privatization, and is essentially being defunded by the state. And we're still waiting on a lot of details about how that's going to work. There's a lot of questions, there's a lot of concerns about whether the same level of patient care will be maintained, whether it's even financially viable, whether the feds will even approve some of the structures that the General Administration is trying to set up. I won't get into all the details because I don't even understand all of them, and this is my full-time job. But it's very complicated, and to essentially defund and privatize 8 hospitals in 6 months, I think we all know that that's a pretty wild ride, and we're very concerned that that's going to mean, not only will people not have access to that Medicaid expansion coverage that should be there, but what the safety net that they traditionally fall back on is going to be significantly weakened, and it's going to open up a lot of holes in coverage that are going to mean less access to care, worsening of chronic conditions, and ironically, in the long run, higher healthcare costs. We know that when people delay care, they get sicker. I mean, it's not difficult to understand that, and that ends up costing more when they do seek care, whether it's charity care or whether, especially in the last recession, we have a lot of folks in their 50s who lost their jobs and had a hard time paying for health care. And a lot of those folks are trying to ride it out until they get to Medicare. There's been a lot of research around this. People who've been uninsured to become eligible for Medicare, the federal Medicare program, costs more than folks who were previously insured. And that trend doesn't just happen at 65. 10 years later, when they're 75, they still cost more because putting off health care for the years they were uninsured increased the cost overall. So, when you kind of take a long view picture, Medicaid expansion just makes sense on so many levels. It's good for patients, it's good for healthcare providers who are going to get paid, who are maybe currently providing charity care. It's good for the long-term budget outlook. Reduce mortality, better health. I mean, what's not to like? And on top of that, we think there's a significant economic benefit. Everybody's talking about jobs all the time. A group looked at this and ran the economic modeling, said that the billions in federal funding for Medicaid expansion would create 15,000 jobs in the state of Louisiana. It's a lot of jobs, and we think even beyond that, there's more unquantifiable benefits to employers who would have healthier employees, more productive employees. People would be able to work longer because they'd have access to health care. So there's really kind of no way to cut it. This is just the right choice for Louisiana.